about efficacy of clear aligners in controlling vertical tooth movement, a systematic review.
Thank you. It's a pleasure to take part in this conference and give a systematic review of efficacy of clear aligners in controlling vertical tooth movements. As you know, a aligner generates mixed views, ranging from being impressed to being quickly put off by the high cost and the need to select cases. Because we want to show the value of aligners, the main objective of our study is to assess the scientific evidence on the effectiveness of aligner in the control of orthodontic movement and especially vertical tooth movements. A systematic review was done in the 10 last years in the following databases. The main keywords are orthodontic or clear aligner or Invisalign and effect or outcome. The inclusion criteria for admittance in the systematic review are prospective and retrospective studies on patients with permanent denture, studies with description of the device used, studies with statistical analysis, while the inclusion criteria are studies on surgical orthodontic treatments, studies with fewer than 10 patients, and literature reviews and authors' opinion. We start analyzing almost 2,000 articles. In the end, we have kept only 5 articles which corresponding to our criteria. 3 retrospective and 2 prospective studies. This review identified only one publication, only one study, which the intrusion of anterior teeth was investigated. The highest accuracy of intrusion was achieved by the upper central incisor and by the mandibular central incisor, while the lowest accuracy of intrusion was achieved by the upper lateral incisor. This leads us to say that aligners are efficient to treat deep bite malocclusion. Extrusion is the least accurate tooth movement to perform with clear aligners with 30% of the predictability, and the central incisor showed the lowest accuracy. In general, open bite is a challenging malocclusion to treat. However, aligners were as successful as fixed appliance in controlling vertical buccal occlusion even years after the end of treatment, and you can show it in the publications. We cannot talk about a systematic review without mentioning the article of Dr. Rossini about the efficacy of clear aligner in controlling orthodontical tooth movements. And you can see here the results. Take-home messages. The literature is poor about the efficacy of aligner studies. The devices applied in the study were Invisalign. For more efficacy of aligners, technology must develop more auxiliaries. Clear aligner is effective in controlling anterior intrusion, but not anterior extrusion. This lack of efficiency could be due to the difficulty of the appliance in developing enough force to extrude teeth in a significant way. The use of aligner is recommended for the treatment of simple malocclusion, deep bites, and very light overbite discrepancies. Therefore, aligners were as successful as fixed appliance in controlling vertical buccal occlusion even years after the end of the treatments. Thank you for your attention.